I think one of the key challenges we face in the NHS when looking at making data and analytics decisions is around data quality and the availability of that data. Understanding that the data often has biases built into it and how we then address those biases. And then, of course, what we find is that the more we use data, that improves data quality as it goes on. And then next, it's access to that data, and it's ensuring that we work with communities to make sure that they understand why their data is being used and for whatever purposes. So what we don't want is another care.data or a GPDPR, again, where you have people where we've sought the data for all the right purposes, haven't communicated this properly, and then, of course, these big projects kind of fail because people don't understand the reasons behind it. And then finally, I think it's making sure that we have the technical expertise. You've got the people who are capable of handling these big, large data sets, who can then work with system leaders around problem formulation. I think we've mentioned a few times already, to make sure that we are getting the answers that you need. What do you think, Esther?
I agree. I think a lot of it within companies as well as within complex systems comes down to trust. So is the data reliable? Do we understand fully the different biases and the lenses that need to be put on it? And have we got the right governance practices around it? And I think particularly for life science companies, obviously today's conversation, we're talking more about the UK, but when you're operating in a global sphere, considerations around data privacy and security, of course, become even more complex. So making sure that we've got the right systems and processes and governance policies to be able to manage data well, transparently, and with a high level of trust from all stakeholders is absolutely key. I guess one of the other challenges I see from a consulting lens is also that data from different settings and different countries is rarely similar. So actually being able to integrate really disparate sources in a way that makes sense without reducing that bar of trust and reliability is an extra problem that companies often have to face. So the inconsistency of how electronic healthcare records, for example, are implemented around the world means that you've got a real asymmetry of data. And if you need to make decisions as a company, you're often making decisions on a global level, not only on a local level. So being able to navigate the complexity of that data environment is really key. And I think another point that I would say is strongly in common with, for example, the NHS as a system, is the need for skilled people and having a skilled workforce who don't only understand how to actually manage this complex data, but why, and actually being able to integrate it into the context of what you're trying to solve ultimately is what matters most.
Yeah, I certainly agree with you on the skilled workforce, but then again, there's a huge conflict of because of my role at AFA, the Associated Professional Healthcare Analysts. We definitely need not just skilled technical analysts, but analysts that you can rely on, that have continued professional development. Absolutely. To ensure that they do their best possible job kind of going from there. And again, this investment in data infrastructure, we've seen some wonderful examples of where this has worked. So you look at the wonderful work the Bennett Institute and Ben did with Open Safely, with the data that supported COVID research. There are examples in SAIL in Wales with the SAIL dataset, which is a fabulous dataset, and even the Kent integrated dataset, the KID, down built by Abraham George and the guys down there. Again, a great data set that helped people with planning that the community was involved with. And of course, finally, Cypher up in the Northwest, which have done a great job of engaging the public around why their data is being used. So there are some great examples of where people have got it right with the right kind of technical expertise behind.
And I think as we look forward, there can be so many more great examples. So we've talked already about the future potential of artificial intelligence. It's not too much of a leap to imagine continuous streams of data from registries or different real-world evidence studies that are set up to mirror and really explore the effects of new drugs, treatments, or interventions in practice. But are we ready to deal with what those tell us? And are we putting the right systems and thinking in place to be able to act on what it tells us? And to be able to do that in a transparent and trusted way between life science companies and systems.